Could the future of cancer treatment lie not in more powerful drugs, but in our very own bodies? Welcome to a deep dive into the latest breakthroughs in cancer therapy, where we explore the exciting world of immunotherapy and gene therapy. First, we turn our attention to immunotherapy. Dr. Emma Thompson, a leading oncologist, shares her insights. Immunotherapy has the potential to turn the tide against cancer, she says. It's about training our immune system to recognize and eliminate cancer cells. Imagine an army of cells armed and ready to wage war against cancer. This isn't a distant dream, Dr. Thompson continues. We have already seen remarkable results in clinical trials. Patients with melanoma and lung cancer who had exhausted all other options are now living longer and healthier lives thanks to immunotherapy. But how does it work? As Dr. Thompson explains, immunotherapy involves the use of drugs that boost the immune system's natural ability to fight cancer. It's a bit like turning up the volume on your body's own defense system. Moving on to gene therapy, we hear from Dr. James Martin, a pioneer in the field. Gene therapy is a game changer, he asserts. It allows us to correct genetic mistakes that cause cancer. It's like going into a manuscript and editing out the typos. Dr. Martin goes on to share the success of gene therapy in treating blood cancers like leukemia. In one trial, 8 out of 10 patients saw their leukemia go into remission. That's an incredible success rate for a disease that was once considered a death sentence. The potential of these treatments is vast. As Dr. Martin puts it, we're not just talking about extending life by a few months, we're talking about the potential for cures. To summarize, we are on the cusp of a revolution in cancer treatment. Immunotherapy and gene therapy are offering new hope to patients with the promise of turning incurable cancers into manageable diseases and perhaps even curing them altogether. Immunotherapy harnesses the power of the body's immune system, training it to recognize and eliminate cancer cells. Gene therapy, on the other hand, corrects the genetic mistakes that lead to cancer, offering the possibility of a cure. These treatments are still in their early stages and much research is needed to fully realize their potential. But the early results are promising. As Dr. Thompson and Dr. Martin have shown us, the future of cancer treatment is not just about more powerful drugs, but about smarter, more targeted therapies that work with our bodies, not against them. In the words of Dr. Martin, we're not just treating cancer anymore. We're fighting it on its own turf, with its own tools. And that, dear listeners, is a future worth striving for.